So dialysis emergencies, which we've been hitting on this, and the only definitive treatment for these patients that have chronic kidney failure is going to be that dialysis. They've got to get to, so they need to get to a facility that has dialysis. And I mean, for years, I worked in a system, I worked for a hospital, and this was just always blew my mind because this hospital would not accept dialysis patients. They did not have a dialysis machine, and if we brought somebody there to the hospital that was on dialysis, they had a fit. It didn't matter what the problem was. It could have just been a laceration to their hand or something.
Right.
They're like, don't bring dialysis patients here. Luckily, that's changed. But it made me realize whenever I went to work in the emergency room and stuff, how difficult it is to get these patients transferred to a facility that has dialysis.
Right.
And the difficulties behind all that.
And then if something happens, so on the flip side, because I was the same way, I'm like, they literally smash their hand with a hammer. They just happen to have a history of dialysis. Take them. Well, you're being an ass. But the reality is, on the flip side, my mother-in-law needed dialysis. She would go in and out of the hospital for different reasons. And on the surface, you take her up to the hospital, maybe one day, after 6 hours being in the ER, she'd come home.
Right.
But then a week later, when she went up there for something similar, she'd go in. Now she's admitted. And now being admitted, she has to have dialysis. And there was a huge issue that could have been legal that I don't know. But it happened to do with Rockdale didn't have dialysis. And so her doctor, my mother-in-law's doctor, was throwing a fit to get her transferred because Rockdale refused to. They had it. They just wouldn't give it to her. I don't remember how it went. But basically, it was an issue because now she's there for a week and needs dialysis and wasn't getting it.
Wow.
It wasn't this full-on blood dialysis, but there was a version of it.
Right.
And ultimately, her doctor basically brought in his own stuff and did it for her. But so I get kind of why ERs are like, don't bring them here. But there's got to be some kind of protocol that falls in the middle. It sounds like we're getting that now.
Yeah. I mean, if your patient is coding really bad, you go to your closest appropriate hospital.
Absolutely.
But if you can, it's best to get them to that facility that can take care of them in the best manner so that they get the dialysis because they have to have it. That's the only way that they're going to get those toxins and stuff filtered from their body because their kidneys are not there to do it. And without that dialysis treatment, they're just going to have a buildup of those toxins and
fluid,
and
which
fluid
can lead to that pulmonary edema.
Yep. If they, like it says here, if they miss dialysis treatment, that pulmonary edema can occur. So now we got a patient who's kind of going in CHF. And what do we do to treat congestive heart failure? We give them normally
Lasix,
diuretics, right? So they can't get it out. So
or BVM.
Yeah. But then all we're doing is pushing it back in the vascular system.
Exactly, and it's just not going anywhere, and it's because it's not coming out of the body. Yeah.
Yeah, and we've got to get this patient somewhere where they can get that fluid out. If not, it's going to back up in their lungs. They're going to start basically drowning.
Yeah.
So the dialysis machine's job is there to function like it's a kidney, pretty much. But there are adverse effects, and I've seen this firsthand many times. I've gone out on patients where, and this has been frustrating sometimes because I worked in a 911 system for years, and I did not do hardly any dialysis totes for 10 years. Now, the first 10 years of my career, I did a lot of dialysis totes. But then I went to another service and worked, and we didn't do we did interfacilities, but we didn't do nursing home to dialysis or home to dialysis. That just not what we did anymore.
Sure.
All right, so dialysis emergencies here. And with this dialysis machine that we take these patients to, it acts like a basic kidney.
Yeah.
But not as good. Our kidneys are best. Even though this machine can help maintain somebody's life, it can for a while. But not as well. There's a lot of side effects to it. And we have some adverse effects of dialysis here. Hypotension, muscle cramps, nausea, vomiting, hemorrhage from the access site, which can be pretty bad.
I've actually never seen that, but I've always been wary of it.
Oh, yeah. When I used to do transports a lot, we would go out on them and we'd have clamps on them. They have like special clamps to put on it. And before they go home, they leave that clamp on for so long to get it off. But sometimes
Sure.
it would stop bleeding. I've had to transport them to the hospital, and I would take ace bandages on it to put on it to try to stop the bleeding
Wow.
and stuff. And infection at the access sites are always there.
Right.
But I was, for the first 10 years of my career, I did a lot of dialysis transports. And then I went to a service that was primarily 911 and went to doing virtually no dialysis transports.
Sure.
We'd go out on a lot of dialysis patients needing emergency treatment, but not that normal routine. I'm picking them up at their home and taking them to the dialysis center and picking them up dialysis center and take them home. What I did was they're at the dialysis center and now they're coding, so I'd go pick them up from there.
Yeah,
or they're
yeah.
at home and they're not doing well. But there was a lot of times in my career that I would go out to somebody's home post-dialysis and they would be really hypotensive. And I'm like thinking, all right, this just didn't happen.
Right.
Did they not get their vital signs checked before they left? Did they not get them checked en route on the way here? So it's important not to get complacent in these patients. Check their vitals, especially before you take them home.
Yes. And that's the other part of that simple history. When you go out on a 911 call and you find out they're a dialysis patient, when was your last treatment? When were you scheduled for your next treatment? Because many times it's, well, I was sick on Monday, and now today's Wednesday, and I'm still not going. Now I feel really bad. Well, that means Friday was the last day they had dialysis.
Yep. And
On
that
an
just
every other day basis. So,
and it's
yeah.
compounding upon itself.
Yeah.
there. So our emergency care for these patients is maintain the AVCs.
Always.
Right?
Be closing, right?
Give them some O2. Probably need some oxygen. Manage bleeding from an access site if needed. Position them sitting up if they're in pulmonary edema. Supine if they're in shock. So look at the two. If they can't lay down because you try to lay them down and they can't breathe, don't force them. So let them get in a position of comfort and transport them promptly to an appropriate facility that can provide appropriate care for them.
Yeah, you're going to need to, if you're having issues right now, more than likely they're going to stay in long enough to need more dialysis.
Yeah.
So you need to make sure that can happen.
Because not taking them to the right facility can just delay that definitive treatment that they or semi-definitive treatment.
Yeah.
They need the dialysis so that they can do it again in a couple days. Because it's just their life until they get that transplant. And there's a lot of people out there needing kidney transplants. There's a lot.
And the list is long and hard to come by.
Yep. Well, we survived, or you survived another one. I'm here too, but you survived us and stuff. Once again, hey, Tom and Charles here.
Yep.
Questions, if you've got them, we'd love to hear them. You can reach us at info@gaiems.com. info@gaiems.com. 24 hours a day, 7 days a week. You can call us at 678-561-2368. You can find that number at georgiaemt.com as well. Call us Monday through Friday, normal business hours. We'll answer questions for you the best we can. Just remember, what's at the end, Charles?
That quiz. You will not get credit for the CEU if you don't get that quiz done. So please make sure you do your quiz, or you just like watching us, and we'll take that too.
You can watch us again if you want.
Yeah.
We're here. Tell your friends, tell your buddies. Come get some continuing education with us. We'd love to see you on the next one. And until then, have a good one.
Remember to flush.
Help.
You